everyone, welcome to today's episode where we will delve into the world of skin and, most importantly, dry skin. We all know as temperatures lower during winter, many of us will find ourselves battling dry, flaky skin. So today we will explore the factors that will contribute to winter dryness. Also, what we'll do is we'll debunk some of the common myths and share practical strategies to help you look after your skin better. We will give essential tips and insights to help you combat winter woes and maintain healthy, moisturized skin. So, just as a start, Steph, what exactly is dry skin? What is the definition of dry skin?
Yeah, I mean, the name already says it, dry skin. And as many of you, I don't know about you guys, but I have experienced it in my life, and I've experienced it as a young person and even in my adult life. So dry skin is basically when your skin doesn't have enough moisture to keep it feeling soft. So sometimes it usually is as a result of your outer layer of the skin not able to trap in the moisture, so which leaves you like having this dry skin. So it may have you having like flaky skin, itchy skin,
Yeah.
a bit of roughness. Sometimes it can affect like maybe just some patches, like some areas of the skin, not the whole like skin area, just like a little patch. So with me, I usually when I have dry skin, I usually get like um cracks. So these are some of the signs that you may notice that okay, you have dry skin. So I have like cracks on my legs. So which sometimes it just means that I'm not getting enough like moisture in that area. So in,
Yeah.
in dry skin, there are different severity of it. Some dry skin can, be very debilitating, where it can cause a bit of like you itch so much that your skin can crack open and even bleed. But those
Yeah.
are very severe cases. Like in no in most cases, dry skin is quite self-limiting, or when you use like home remedies, it usually goes away. But the main thing that when you have dry skin is basically the rough patches of it, not feeling
Yeah.
tough, like when it's
Yeah.
flaky. Yeah. Most of the time it's because you're not getting enough moisture. Yeah. There are things that can actually there are cause things that can cause you to have like dry skin. So it could be because maybe you're allergic to something, but there are causative things about it. So it's best to find out what is making you have that dry skin. Speaking of like
That's
what
it.
could cause like dry skin and stuff, I don't know if you've encountered it and what actually made you have dry skin. Do you know what sometimes can cause dry skin?
Do you know what? I'm glad you said like you get cracks on your legs, but I
Yeah.
get cracks on my hands. And I used to think this is terrible, but maybe it's just a shallow part of me. I was like, oh my God, people don't moisturize enough. Like they've got dry skin
Mm,
kind of thing, right? Because I think maybe just as Black people, we are like very big on moisturizing because I suppose our skin can get quite dry.
yeah.
Um, so it's only like recently that I've noticed, oh my God, I've got cracks on my hands. And it's mostly
Mm,
because, first of all, in the winter, um, the air, the dry air in the winter, in the colder months, can actually dry skin.
mm,
It can strip the skin out of your sort of natural oils and moisture, and this can lead to dryness. So that has been one of the factors, I suppose. So environmental
mm,
factors can actually cause dry skin. But
yeah.
also, in our job, Steph, we're constantly washing our hands. So
Yeah.
you see a patient, you touch something, or you touch a prescription that is looking a little bit like it was, it was being chewed by something. And you're thinking, nope, I need to wash my hands. So we're
Yeah.
constantly washing our hands. And I find like by the end of the day, I've literally washed my hands so many times. And I think by washing hands so often and maybe using hot water as well, because
Mm,
I I don't do cold water. Okay, I do not do. I don't know how people wash their hands with cold water, but that's not me. So I find that doing that again, it just is not really helping my
Yeah.
skin. So I find like my hands get really, really dry because of that. So again,
Mm,
hot water and harsh soaps can actually cause dry skin.
mm,
So it's worth knowing what is a trigger to your dry skin, because the little things that you don't even realize could be what is causing your dry skin. So a lot of people do use hot water, like very hot water for
mm,
showers, which, especially in the winter, you come in, you're very
yeah.
cold, and you just want to get really warm. So you use a very hot shower, but what you don't realize is that, first of all, you're stripping the natural oils from your skin, you're disrupting the
Yeah.
skin natural barrier, and you're causing your skin to become very dry and irritated. So
Mm,
knowing some of these things is very important. So hot water and harsh soaps can actually cause dry skin,
yeah.
and also, as we mentioned, humidity. So dry indoor environment. So in the winter, when the heating systems are used, it can actually cause the skin to lose moisture. So just knowing this as well, it's worth just knowing, of course, some of these things so you keep your skin moisturized. We
Mm,
also know that with age comes dry skin. Sorry.
yeah.
So with age comes sort of like thinner skin, which I suppose will produce less oils, and that will make it easy to sort of dryness. So with
Mm,
age, a lot of older people, you'll notice. I don't know about you, Steph, but like sometimes I would see my grandma like take off, like, I don't know, like a sock, and I'm like, oh my god, like there's like literally like
yeah.
flakes falling,
Very
and it's
active
just
as
because of
well.
age.
Yeah.
Yeah, it's just because of age, like it's not like
Mm.
she's not moisturizing enough, or she's dirty. So, guys, let's give grace to the old people. They've been through quite a lot, and dry skin is the last thing we need to be giving them, pain about. So, age can actually cause dry skin.
Yes.
And also certain skin conditions. So there is certain skin conditions that can actually cause dry skin, but we will talk about the skin conditions because they will come under what dry skin really is. And
Yeah.
also, not to mention that, genetics. There's some people who are just genetically predisposed to having dry skin.
Yeah.
So it could be family history. It could even
Mm,
be ethnicity that could play a role in this. So you might notice that sometimes, I don't know about you, Steph, but I notice that sometimes you'll get a patient come in and she suffers from dry skin, and she gets maybe something for it on prescription, or maybe she buys something off the counter. The children
mm,
will also suffer from dry
yeah.
skin, and maybe the mom to this person or the parents to this person
Yeah.
will also suffer from dry skin. So it can be part of family history.
Yeah.
So there is a lot of things that can cause um, dry skin. Mine is mostly environmental and hot water, but I struggle. That is my weakness. I
Yeah.
really struggle to just shower with like lukewarm water or cold water. I like, it's just the comfort of knowing like this hot water on your hands,
Yeah.
on your body. It's just nice, isn't it?
I'm the same. I'm the same. It's
So talking about dry skin conditions, there is some very major ones, Steph. Which
mm,
which are the most common dry skin conditions that I suppose you have seen in just in at work, or just in life,
mm.
basically?
So, most of the time, what I come across is that people have like contact dermatitis, and
Mm-hmm.
this is a type of like dry skin. So that is
Mm-hmm.
when they probably come in contact with something that they're allergic to. So then it
Mm-hmm.
may cause them to have like a reaction to it. So they may get
Yeah.
like a rash, itchiness, dryness, a bit of redness.
Yeah.
So these things that they come in contact with could be anything like
Mm-hmm.
jewelry, it could be like
Yeah.
detergent, it could be cosmetics, that sort of thing, medications,
Yeah.
some metals. Yeah, these can all cause these contact dermatitis. Contact dermatitis, you're getting contact into it. So I think what I noticed actually is that I have a bit of like a mixture of these things. I do have a bit of
Mm-hmm.
contact dermatitis, like just certain jewelry I know when I put on my skin, I'm probably gonna react to it. It becomes so dry, you can literally see it. So I tend to stay away from like fake jewelry because I know I'm not
Mm-hmm.
gonna like react to it very well.
Yeah.
Even like you mentioned, like genetics. I know my family, yeah, we probably have like long standing of like dry skin, like my brothers, my
Yes.
dad, my mom, we all have that.
Yes.
So, yeah, I kind of know that I have like a mixture of everything, and I also like to have like my hot showers, like Trudy said. I'll be in the shower, yeah, for like 15 to 15 minutes, yeah. My husband will be like, "What am I doing?"
Exactly.
Like, I'm enjoying myself, mate. But but
Exactly.
yeah, like honestly, I know it's not good for me. I know that's what causes my dry skin, but I still do it. I just
It's
can't
difficult.
help myself. I
Yeah.
literally cannot. Yeah.
Yeah.
So with me, it's like a mixture of these. Um, but there are some like some other types of like dry skin again. So there is another type called eczema. So I'm sure a lot of people have come across it. A lot of people have eczema. So eczema is basically when it's a skin condition which you
Mm-hmm.
get dry skin, you get but sometimes it becomes like dry and bumpy and very
Yeah.
itchy patches in your skin. And
Mm-hmm.
there are like severity of this eczema where sometimes it can be really bad for some patients. It
Mm-hmm.
can really crack your skin so much that they can actually be prone to infection. Um,
Yeah.
it can be really bad for some people. Again, it can be worsened by like irritants, allergens, and stress when it comes to
Yeah.
eczema. But you still get that dry skin as a symptom, very flaky, very itchy,
Mm-hmm.
that sort of thing. Yeah. So there are different types of dry skin. Another one actually that comes to mind as well. You may see it in like infants, which is called like cradle cap. That's when they have their dry skin on their scalp. And it could also happen to like adults where like adults have a bit of like dry skin on their scalp. But in infants we see that a lot. Like, you see their scalp is a bit yellowy, a bit dry, a bit itchy.
Mm-hmm.
Yeah, but with time it does go, and with some products it does go. But again, you get like the dryness of it, and it can happen. Sometimes it can happen, and it can actually occur in different areas, not just the scalp. Yeah,
Yeah.
when it comes to this one. Um, there is another type where I think most of the time some people associate it with fungus. This is called athlete's foot. So
Yeah.
when you get like dry skin in between like the feet area, they usually call it athlete's foot because some the athletes usually like cover their feet a lot and it becomes really sweaty and basically it's caused by fungus. That's when you get it may cause like dry skin, a bit of flaky skin and things. Um, but all in all, there are different types of like dry skin, and dry skin can affect different areas of your skin as well. So
That's it.
it doesn't just like affect like one area. Sometimes it just affect your hands, your legs, or everywhere. That's what usually happens. I mean, Trudy has already gone through like who it affects and stuff, depending on who it affects as
Mm.
well. If it's an old person, it's mostly like areas around where the skin is really. I think you mentioned something about the weather, and
Mm-hmm.
I wanted to ask you something. But have you realized also in summertime, I think you said in wintertime you're more prone to dry skin, but
Yeah.
have you realized that in summertime as well, sometimes you get dry skin? I don't know about you, but I get it as well, during summer. You may think that
Yeah.
maybe because the summer it's a bit humid and stuff that you might not get it, but also the heat in during summer, it makes the moisture escape from your skin a lot more
Mm,
easier, like a lot more
yeah,
quickly. So it's better to, like, well, it's not even better, it's actually ideal for you to keep your skin more, hydrated during summer. Some people usually say, oh, it's just a winter thing, but climate, like
yeah,
no matter what the weather, whether summer or winter, it does,
true. All year
yeah.
round, people need to be moisturizing. Come winter, summer, spring, autumn,
That's
moisturizing
right.
skin.
Yeah, yeah. But sometimes I feel like some people need to get an allergy test if they find out that like your dry skin is not going. That's what I've
Yeah,
realized because it could mean that they are allergic to something because
that's it.
as much as we say like there are environmental factors and genetical factors, it could mean that you are allergic to something,
No,
because
um,
sometimes you might try all the products in the world, yeah, and your dry
mm-hmm.
skin may still not
I'm
be
still
like
having dry
healthy.
skin.
Yeah.
Yeah,
So sometimes I usually
yeah.
just tell my patients, maybe you're allergic to something. It might be worthwhile to actually, do an allergy test and see what substance is causing you to, have these symptoms. It is something that is, yeah.
I mean, it's good that you
Um,
mentioned that, Steph. I think it's very important that
mhm,
whenever say someone has tried anything, maybe even over the counter, they've come to the pharmacy, we have suggested something to use to try and help, maybe relieve whatever it is. If that becomes a recurring thing, go to the doctors, get the extra checks. Allergy test
mhm,
is one of them. That people don't realize, like there's so much you could be allergic to, and you just don't know it, and you keep thinking, oh, it's this or that, but it's something maybe completely different, unrelated.
we've gone through like the causes, the symptoms, like, so what would you on a normal basis like advise your patients? How would they manage it? Because there are some things out there that people are doing. As I mentioned, dry
Yeah,
skin is sometimes it is self-limiting, but most of the
it
time
is.
you just need some
Mhm.
self-care and some home remedies to help you. So what would you advise like your patients? How would they manage it or treat it?
Okay, so with different dry skin conditions comes different treatments. So again,
Yeah,
there's no one size fits all. Like dry
yeah,
skin, let's use this.
yeah.
Because that's, to be honest, the reason I say that is I don't know if you've heard this, Steph. I don't know if anyone's come to you with this, but a lot of patients come to me and they say they've been using pseudocreme for, it could be something completely different. They say we tried pseudocreme, it's not working. I'm like, but you don't need them. I don't know. People think the pseudocreme is like is
I
a
call
savior.
I call it the magic cream in my house, yeah. But
If
I
pseudocreme doesn't
wouldn't
treat it,
use it for
if
dry
pseudocreme don't
skin.
treat it, nothing will.
But I wouldn't use it for dry skin. I just like, tell my kids, okay, pseudocrine is a magic cream. Like when they have maybe like a bite, like there's something wrong with them. I just put like pseudocrine, and it honestly works. Don't put down pseudocrine, yeah. I
No,
just
it
don't
is
like
an
to put,
antiseptic cream, so it
yeah,
will work for a lot of things, but it
but
is
not for
not going
dry
to
skin.
solve
I know.
everything. Like they say, I've tried pseudocreme, it didn't work. I'm like, okay. So it's like if pseudocreme doesn't treat it, then it's not treatable, basically. Um, so there is there is a lot of that I hear that
Yeah,
okay, I've tried pseudocreme, it didn't work,
yeah.
and it's
I
something
mean,
honestly something
no.
that pseudocreme is not going to really
No.
touch, you know?
Pseudocrine is very dry.
Yeah.
I usually put
So
on like it's like a boil or something to extract it. So I wouldn't use pseudocrine for
yeah,
dry skin or
because
dry
it's
skin.
a
Yeah,
barrier cream, so you have to be careful
yeah,
as well. Because with a barrier cream, you're not letting any moisture go in as well.
that's
So
fine. Yeah,
sometimes just seek that healthcare advice on a few things that you might not be sure. Just
yeah,
because your mom has said, pseudocreme is the miracle cream. If pseudocreme doesn't treat you, nothing will. It doesn't mean that that is the case.
yeah. I'm one of them.
So exactly. Don't be like Steph. Um,
Mm.
so so different skin conditions will normally have different treatment
Mm.
options. So if it's any sort of like dry skin conditions like eczema, so moisturizers, regular moisturizers would be really, really
Mm.
good. But specifically moisturizers that are fragrance free will normally help hydrate and protect the skin barrier. So in pharmacy, there is something we call emollients. So emollient creams would be the likes of the ultra base, the double base, this kind of creams, E45. These are creams that have got such good that will give the skin such good moisture, and
Mhm.
it would be very they would be very useful in something like eczema or in a lot of dry
Mhm.
skin conditions, to be fair. And then also what we also recommend sometimes is topical steroids. So over the counter as well as prescription only steroids can be used, especially
Mhm.
if there's inflammation and itching during flare-ups. But it's very important that you don't use steroids in open, like when the skin is open. As Steph mentioned earlier, sometimes the dry skin can actually cause the skin to actually open and even cause wounds and bleeding. So it's very advisable that when that is happening, don't use things like steroids, because that is not going to be, that's actually going to make you worse, because steroids thin the skin, and on open skin it's not going to actually help. If anything, it will actually make the condition worse. So it's just knowing what kind of skin condition you have and what kind of treatment would be suitable for you. I do hear a lot of people come to pharmacy and they're like, oh, can I just not buy this? Oh, my aunt used it, or I used my aunt's and it
Yeah.
worked really well. And again, that kind of, if anything, it actually upsets me sometimes, because I'm thinking, you're self-medicating. You don't know what it is that is going on with you. Just because it helped maybe once when you used it doesn't mean it's actually what is going on. So it's
Yeah.
always just worth seeking some advice, seeking, a professional's advice, a medical professional's advice, just to make sure you're not actually misdiagnosing yourself, or you're not mistreating yourself. You're actually treating the
Yeah.
right condition and you're using the right medication. Um, so sometimes for some dry skin conditions that would affect the scalp, there is medicated shampoos that can be used. So sometimes you get some that have got like coal tar extract, which I actually love the smell. This is so debatable. I love the smell of coal tar shampoo.
Yeah, you're on your own.
Let me tell you something. I'm not right in the heads, because
You're on your
no
own.
one likes it. No one.
Only you
Honestly,
two.
no one likes the smell of Kosa shampoo, but literally when I'm down in the pharmacy, I'll sniff a little bit. I'm like, yeah, I'm
Oh
good.
no.
I know it's terrible, but it's just I don't know. It's the same way some people like the smell of petrol when they go to the petrol station.
Don't.
I like the smell of coal tar shampoo. Um, so coal tar shampoo can actually help normally sometimes reduce inflammation as well as the flaking of the scalp. But
Yeah.
when it comes to say dry skin, a dry scalp, a lot of things could be causing that. So it's also worth just knowing what is causing your dry skin, avoiding these triggers. Because sometimes, as Steph said, it could be even fabric. So it could be something that is you're allergic to. It could be a fabric that you're using or something you're wearing that is causing
Mhm.
this dry skin. It could be some of the skincare products that you're using. So
Yeah.
you've gone somewhere that said to you, this will get rid of all the, but no, it's actually causing you to have the dry skin. So it's just worth knowing what is actually causing the dry skin. So it's very important, as Steph said, just always get maybe if you've tried a lot of things, if it's something that's recurrent and you don't think that you're getting anywhere in terms of treatment, just maybe get that the allergy test and just see
Yeah.
maybe what you could be allergic to something.
Yeah.
So there's also depending with again what are the kind of skin conditions that you have, there could be other sort of like topical treatments that you can get off the counter. So it could be even things like retinoids, which you can use to help reduce inflammation. And there's also phototherapy. So this is normally exposure to UV light and, of course, medical supervision, because this can sometimes slow the growth of skin cells and reduce inflammation. And this is in the case of things like psoriasis. And also the doctors can sometimes prescribe even or you can actually buy sometimes salicylic acid over the counter. Um, so some preparations that have salicylic acid can help soften the skin as well as remove scales, which in this case would be causing something like psoriasis. And there's literally so many different medication that you can use, but it's very important that if you have dry skin condition, maybe look into your skincare routine. What is it that you're actually using? Is it harsh products that you're using? And after you've had your showers, are you actually moisturizing? And what are you using to moisturize? Because sometimes it could be what you're using is actually what is stripping all the oils from your skin. So a good emollient, a good moisturizer is very important in managing dry skin condition. And of course, if you've tried that, if you've been moisturizing and you've been uh, avoiding the things that could worsen dry skin, and it's not improving, then maybe it might be worth going to speak to your doctor, speaking to a healthcare professional, just seeing what other alternative there would be that would be available, just to help manage dry skin. And look, I don't know if you have any others, Steph, that you can think
Yeah,
of, any other treatments.
yeah, I wanted to add on to you. I think you mentioned like people that use products that contains like fragrances, but there was something that I also used to look at where like
Mm-hmm.
there's some products I check if they have alcohol or sulfates. You know, sulfates, they usually strip the
Yes.
molecules out of like from your skin.
Mm-hmm.
So I usually avoid like any products that contains like sulfate. Even for my hair, I don't use shampoos that contains like sulfate because they make it dry. So I
Yeah.
think it's one thing that people need to watch out for. Check the products, make sure it contains no sulfate, no alcohol, those sort of things.
Mm-hmm.
Also, maybe include products that have
Mm-hmm.
like that can hydrate your skin a lot more better. For instance,
Yeah.
glycerin, like shea butter. I'm not gonna lie to you, I love shea butter. Yeah, I
Is it
slather
good,
shea
Daniel?
butter on my kids. Yeah, when you see these kids, they'll be shining from afar because they have
Of course they'll be
shea butter.
shining. They're Ghanaian kids. Why wouldn't they shine from using
Honestly,
Sheba?
honestly, I love shea butter. They attract moisture, so they keep the skin
Yeah,
nice and
that's.
soft. Yeah, I'm serious. I love that. So any products that containing glycerin, shea butter, or even cocoa butter, they are your
Mm,
friend. Like, honestly, they attract so much moisture and they keep the skin nice and soft. So that's one thing
mhm.
that I would also advise. The other thing is, I think let's just put it out there, yeah. As blacks, yeah, it's like we have something against sun protection. Let's put it that way, like, sunscreen. I think we need to use products that contain good SPF to
Yeah.
offer us that protection because from the sun, because again, the sun also affects our skin and
Mm,
sometimes it can cause you to have dry skin. So um, you may think, oh, okay, it's just maybe summertime that I need to do that, but even all throughout the year, even winter time, make sure you use your sunscreen or get a product like a cream that contains the
with
sunscreen in there. And honestly, yeah, it's
yeah,
so good. I know some black people they think, yeah, we're very melanated, so we don't need a
they don't
sunscreen.
believe in it. They actually, some people don't believe in it. Like every time it's weird. Every time I meet black people, I'm like, "Do you SPF?" And they're like, "Why? Why do I need to? My skin does that for me." And I'm thinking, "Oh my god! Like you need
Yeah,
to use SPF." I don't think they
yeah.
believe it's a thing.
No, no, people don't. Yeah, some people don't. But honestly, it would do your skin wonders, and you should try
Mm,
it. Yeah, and I don't know about you, Trudy. I think some fabrics as well help. You know, I don't know about you, but You know, there's some fabrics when you wear it, it actually makes your skin a lot more dry, even winter time. So I would say
Listen,
avoid fabrics
yes, I can't
that
just
you
wear
know.
anything, Steph.
Yeah.
I'm glad you say that. Like, when you buy like any outfit,
Mm,
the label on the
yeah.
outfit. So when you buy like a
I hate
top at the
it.
back there, there's normally the label saying, I don't know, size 5, size 6. Well, no, there's not size
Oh,
5.
yeah,
Small, medium, large, right? And
yeah,
then your trousers at the back of it, where your bum is,
yeah,
they will have the same thing. That fabric, my skin, my skin hates that fabric. When I tell you, I'll eat until I'll come up with blood. So you're right. Some
wow,
fabric. No, honestly,
yeah,
you're so
honestly.
right. Some fabrics will
No, it's
just
true.
destroy your skin.
I don't know. I remember there was one winter time. I think I was wearing jeans, and then when I
Hmm.
took off the jeans, yeah, my legs were ashy, like they were white. I was like, what is
I
going on?
could have
It
cooked
was
ugali. Like
bad.
that flour, you can collect flour out of the legs. It's honestly, Sam, you're
Yeah,
right. Do you know, I
yeah,
very rarely wear jeans, but you're right. Like you literally can see the little boxes on your skin, like
yeah,
it's like your skin
yeah,
is forming like some sort of like diamond shapes.
yeah.
Yeah,
So yeah,
100%.
so I work some fabrics. In terms of like the moisturizers as well. Like my skin is very weird. I have
Mm,
dry skin, but there are also areas where I have oily skin. So
okay.
I have
Asian
to
skin.
like battle. Yes, I have to like
Yeah.
find the right balance. So there are certain
Mhm.
creams where I know if I use them, like although they're helping me with my dry skin, but in 10 minutes time, yeah, you see me weeping with sweat.
Really?
Yes,
Wow.
so there's
Do
certain
you know
creams I
what?
stay away.
Like I think I have combination skin as well, but you should see me going to bed. I look like a little chicken that has been marinated, ready to be fried. I
With
am
your oils.
glowing. The oil I've put on my skin, because I'm thinking, I don't know, I feel like sometimes
Yeah,
beddings can strip off that moisture from your
yeah,
skin. So the way
exactly.
I layer it.
Yeah,
Oh my God. It's like
yeah,
I'm literally going on to, like, I'm literally being dropped on a pan to be
yeah,
fried.
yeah. And one other thing is that I tend to stay away from lotions because
Mm,
lotions actually make my skin really, really dry. I remember,
really?
no, yeah, there was one time I decided to swap to Vaseline lotion, and oh
Mm,
my goodness, like the whole of my forehead, I could see like the lines. It was
really?
literally, yeah, but you know, it kind of makes sense though. Like if you have dry skin and you use like lotion, because the lotion is,
Mm,
no,
it's, I suppose sometimes it also depends what kind it is, because if it's thin,
yeah,
because sometimes lotions are meant to be thin so that you almost don't, you're not greasy at the end. So they're not
yeah.
moisturizing enough.
Yeah. It's not,
But
I
have
feel
you
like
tried
it was
E45
not touching the
lotion?
moisture enough. Yeah.
Yeah. Have you tried
Yeah.
E45 lotion? Because I
Evil.
absolutely love E45 lotion. Like,
Yeah, I have tried, not on myself, but I have tried it for
mhm.
like the kids and stuff. And it is good. Yeah. E45 is good actually.
it,
E45
I
is
think as a lotion, it's the only one I will use. Any other
good.
things, no. Any other lotions, no. Creams,
Yeah.
yes, but lotions, it's got to be E45.
Yeah. Yeah. Okay.
So we have spoken about some of the causes, including fabric, but what we haven't actually mentioned is some medications can actually cause dry skin, and this is known as one of the side effects of the medication. So again, just knowing some of these things would be very crucial
Mhm.
in just sort of addressing some of these things. So certain medications can actually cause dry skin. Um, so there is the likes of acetretinoin, which people use for severe acne. But we also know that these can actually dry the skin, the lips, the eyes. It can just cause a lot of dryness on the skin.
Yeah.
And also, antihistamine stuff. Antihistamines can actually cause dryness, as I think is just the way they work.
Mm.
But by treating allergies, they can actually
Mm-hmm.
have that drying effect on the skin. So things like that
Yeah.
can also, cause that dryness in the skin, and a lot of other
Mm-hmm.
medications. So diuretics, which people call water tablets, some antidepressants, some retinoids, medication like lithium, some antipsychotics, some
A
statins,
lot.
even beta
Opioids, like
blockers.
all. Yeah.
Yeah, chemo. Like if you're going through chemotherapy, that can also dry
Yeah.
skin. So it's also
Yeah.
medication can actually cause dry skin. And I suppose if you're experiencing dry skin as a side effect of medication, it is essential to discuss this with your healthcare professional, because you
Mm-hmm.
might be able to maybe adjust the medication, or they might be able to recommend moisturizers or other treatments to help sort
Yeah.
of just tackle the dryness and discomfort, or maybe put you on something different, a different medication. So, in regards to, say, some of the misconceptions of dry skin, I know you've said a few things. You've
Yeah.
said about Black people. Have you had any misconceptions in regards to
Yeah.
dry skin?
Dry skin, like things really. I think I've heard a few actually. I'll
Yeah.
start off with well, we all know that as I mentioned, like dry skin is the cause of like when your skin is not able to like to trap in the moisture and it leaves your skin a bit rough and stuff. So most
Hmm.
people will say, let's say for instance, if you drink more water, you kind of, won't get dry skin. What's your
Hmm.
take on that? Yeah.
I well, I think this is false. So, drinking dry water is good for a good, healthy skin, supple skin,
Mm.
hydrated skin. Healthy skin. Water is literally
Yeah.
the key to a lot of things, right? But whilst you're,
Mm.
of course, staying hydrated, drinking water alone is not effectively going to treat dry skin. So as we said before, dry skin could be caused by a lot of things. So it could be caused by some of the medications you're using, or maybe
Mm.
you're taking very hot showers, so which you're counteracting the whole drinking so much water. So
Mm.
moisturizing the skin um, will with very good creams and very good moisturizers is crucial for
Mm-hmm.
maintaining skin hydration as much as drinking water. So personally, I don't see I don't see how just drinking water will cure dry skin, because there's a lot of people who I know, oh my God, they drink so much water, like they do their 3 liters a day, but they
Yes,
do suffer from skin.
it's true.
Um,
It's
and it's
true.
not to say that maybe they're not doing something right. It could be,
Mm.
again, it could be maybe it's a genetic thing, as we've mentioned before.
Mm.
So there could be a lot of causes. So drinking water alone is not going to treat or cure
Mm.
dry skin. I think there's a
Mm.
lot more to that.
Yeah, yeah, I totally
Hmm.
agree. Like, I mean, that's something like, we all thought like if you drink a lot of water it's going to help with your skin. Yes, water is good for your skin as you
Hmm.
mentioned, but if you're someone that suffers from dry skin, your skin is probably not able to lock in the moisture, so just drinking a lot of water on its
Hmm.
own is not the solution to it. Yes, it may help to some extent,
No,
but you still need to find that substance or that product that would help you lock in the moisture. Um, there are some remedies like watermelon, cucumber, which some people say helps with dry skin because it
100%.
contains water. It has like a high water content. Again, it's like in line, like drinking more water, eating cucumber, watermelon, that sort of thing. It's not going to lock
Hmm.
in the moisture. It would help your skin to some extent, but it's not going to resolve the dry skin. That's basically it.
Yeah.
Yeah. Um, what is your misconception? Like, what have you heard about like dry skin?
Hmm. I mean, some of it you've said, which is
Yeah.
that sometimes I think people sometimes say that they only get dry skin in the winter and not that like not in the summer, you can't get dry skin in the summer, which we have,
Yeah.
we've talked about that, which is not correct.
Mm.
You can get dry skin all year round, regardless of
Yeah.
what time of the year it is, what season it is. Dry skin doesn't pick just the winter months. But I've heard that, and this is, I think, from, it's not quite what I've heard, but it's someone who said something. We were in pharmacy and this guy came with, I think he had very, very dry skin. This, I think, was even not even anything to do with moisturizing. I think there was something more to it, but it was very dry. You could see his skin was
Mm.
very, very dry. And
Yeah.
the girl who was in the pharmacy, I won't mention what their role was, did say something. She said that, oh, he can just scrub off that dry flake, the dry flakes off his hands and then moisturize. Because I'm assuming she was under the misconception of scrubbing the skin really hard to remove the flakes will actually help with the dry skin. Now,
Oh,
Steph, like, just what's your take? Like,
no. Scrubbing, oh no. Like I just feel so sorry for this person. Honestly, people should not do that. It's literally harming your skin. Um, that is probably even how like they got this dry skin in the first place. But the more you
mhm,
scrub, the more you strip that oil, the natural oil from your skin. So imagine if
mhm,
you have dry skin and you keep scrubbing, that is gonna it's gonna make things worse. It's gonna worsen your skin. It will probably even make your skin start cracking, being inflamed, and as we mentioned, cause it to be worse, like even
mhm,
cause like infection, cause some bleeding. So I
yeah.
wouldn't recommend that. If like, you have that sort of, you're in that sort of situation, please, 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 please do not be scrubbing like that. No, no. Like, I don't know why people, even like, some people tend to like use really hard sponges and stuff because they feel
Mm,
they get in the dirt of the of the skin. I don't
yeah.
recommend that at all. Honestly, if
Mm,
you can use a soft sponge on your skin to just scrub, you don't need to be that harsh on your skin. You don't need to be that harsh. Even check the soap. Like sometimes you don't even need to use like soap on especially when you have like dry skin. Sometimes you don't need to use soap on that area. That's what I usually
yeah.
recommend. Like just use a little bit of lukewarm water to just apply on that area, and it might actually do it some wonders. But say you're gonna scrub really hard or
Like,
scrub
how
it
are you
off.
even gonna sat down there really hard? You're gonna bleed. Like, do you know what I mean? Like,
Yeah,
it's
yeah.
and also you're stripping all the natural else. You're stripping
All the
barrier of
oil.
skin. You're just not doing your skin any
No.
favors at all. It's right, Steph. Like, literally, just as long as you're washing every single part of your skin, and you're rinsing
Yeah.
yourself properly. We're not saying don't wash, okay, guys. Wash your legs,
Mhm.
okay. We're not
Of
saying
course,
don't wash
one.
your legs. Please get that sponge, put some soap on that, wash
Yeah.
every single part of the body, and rinse
Yeah.
off. Again, it's very important to rinse off the soap because soap can be drying. So you leave some soap on you, it's actually going to dry your skin. So just make sure you rinse off the soap anyway. Um,
Mm.
but don't scrub. Don't, exfoliation is good, but once in a while. Don't exfoliate every
Once in
day.
a while, not all the time. No, no, not all the
No,
time.
no,
They feel like,
no.
you're doing your skin a lot better by doing all the skincare routine, exfoliating, but no.
Mm-hmm.
Less is even more. Less is even more. Actually, speaking of like skincare and stuff, there was one thing that I actually wanted to ask as well. I heard like sometimes facial scrubs actually cause more dryness as well. What's your take on that?
They can. They can
Mm.
cause extra dryness. Depends how often
Mm.
you're using the face scrub. So if you're using a face
Yeah.
scrub every single day, you're scrubbing the natural oils off your skin. You're basically stabbing that
Mm.
that natural barrier from your skin every single
Yeah.
day. You're not even letting your skin just do its thing because look, we're not smarter than our bodies, okay? Our bodies are actually very smart, okay? So the you know the skin will normally produce its natural oils, but if you're scrubbing that off every single day, you're not going to do your skin any favor. So personally, I would not advise using scrubs every day. Just gentle cleansers. You can use that most of the days of the week, and then maybe once or twice a week you can exfoliate the skin, just getting that dead skin off. But using scrubs every day is definitely a no-no.
Um,
Now, before people think that I am saying to them that they should be putting cream up on cream up on cream, because I said I like to go to bed looking like a chicken ready to be fried, and this is a misconception. You probably have had this where people have said if you apply multiple layers of moisturizer, you moisturize every single part of your body as much as possible. This will really hydrate the skin better.
mm,
Steph, what is your take on that?
no, I don't agree. There are some creams there which I feel will leave your skin unpleasant. Yeah. So, and they may actually
Mm,
lead to breakouts if you keep like applying. They may actually lead to breakouts.
mm,
So, I wouldn't
yeah.
actually recommend that. I would say, you know how like when you get up, shower,
Mm-hmm.
rinse yourself, put in cream immediately, well, after you dry yourself, then put on your
Yeah.
cream. Make sure that, you choose the right cream for yourself. That's where you need to shop around. You need to do some trial and error to see
Mm,
which cream is actually better for you, which one is
yeah.
locking in that moisture.
That's it.
So, and also if you need to, like, let's say, reapply the cream. Which part of the area is it your hands because you keep washing your hands? Then I would say
Mm,
yes, it's good to reapply. But don't be applying
mhm.
different moisturizers on top of each other with different
That's
ingredients
it.
as well, or even if it's the same thing. It's not healthy for the skin. Like as much as
Mm,
we need to trap in that moisture, we still need to let that skin breathe, if you get what I mean.
yeah.
So I wouldn't say I apply a lot of these days. Definitely at night time,
Yeah.
I would say, put that oil like you truly does during nighttime, during the evening. It's
Oh,
best to put the oil on before you go to bed. That helps,
yeah.
trap the moisture
Hey,
in there. So evening time,
yeah.
I would say put the oil, but during the
Yeah.
day, just make sure you get a good moisturizer where you could just apply it. And then if
Yeah.
you are someone that works out that where you're washing your hands more or there are some areas that needs to be reapplied, by all means do reapply it. But I wouldn't
That's
yeah, I wouldn't apply so many moisturizers on top of
no.
each other.
It's
Like,
it's even the same moisturizing. Applying too much of any moisturizer is actually going to lead to even things like clogged pores. So with
yeah,
clogged pores, of course, you're not letting your skin breathe. So this can actually worsen some skin issues. So not applying too much. Too much of everything, guys, is poisonous. Too much of everything is actually poisonous. So just in the right amount is what you need.
what's your take home message for people out there?
Okay. So my take home message in regards to dry skin is one, hydration is essential. So, be it drinking plenty of water, but also using good moisturizer. This is very crucial for maintaining skin health and also preventing dryness. And
Hmm.
also, gentle care is important. So, avoid harsh skincare products and harsh practices. That means the whole scrubbing the skin, because this can strip the skin of its natural oils, and we want to maintain these natural oils to, I suppose, tackle dry skin. And also, consistency is very, very important. It's not just a matter of, oh, whenever you remember, you can apply moisturizer, or, once in a week, you can apply moisturizer. No, just make sure you're moisturizing your skin. You're cleaning your skin, but also you're moisturizing it and also
Yeah,
protecting it from any environmental factors, because this will actually
yeah,
help prevent and just tackle dry skin. And one thing you mentioned, Steph, and I think is very, very important, is just identifying your triggers. And that means if you have to get that allergy test, allergy check. Get that allergy check. See what it is that you could be allergic to, or that could be causing your dry skin condition. And we always mention seek professional help. So if the dry skin persists and is normally accompanied by other symptoms like even the itching, redness, cracking, this bleeding, this is now a sign that you need to get professional help. You need to get someone to look at what could be going on. So just prioritizing hydration and gentle care, consistency, avoiding any triggers, and also knowing what triggers could be causing your dry skin is very, very important in managing dry skin and maintaining a moisturized skin. What about you, Steph? What is your take-home message?
I think you said most of it, but as I will say, dry skin affects a lot of people. You know, I'm a sufferer and it can be a long-term thing. I think it just requires a lot of
Mm-hmm.
patience, a lot of trial and error, as
It,
you said. Um, Dry skin, honestly, can be caused by so many factors, as we've mentioned. Could be contact dermatitis, could be genetics, could be so many things. So watch out for the things that are making you get the dry skin. If you need some medication, seek your seek a professional help from your pharmacy, from your doctor. Most of the time, some home remedies are the key things that usually help with dry skin, you know, just finding the
mm,
right moisturizer. But you've got to
mm,
remember, everybody's skin is different. Your skin is different from your brother's skin, from your sister's skin,
mm,
from your mom's skin. So what works for them may not work for you. So you need
yeah,
to find out that moisturizer that would actually help with that dry skin, or you just need to find out what is causing you to have that dry skin. So as I
mm,
always say, everyone is different, you know, we're not the same. So do find out what works for you. And as Frida mentioned as well, if you know your dry skin does get to a stage where you know you've tried multiple products and it's still not going and it's getting worse, it's cracked, it's bleeding, it's getting prone to infection, please do not sit down and just use like one of the home remedies that we've mentioned. Do
mm,
seek help from your doctor or even a dermatologist. They are the
mm,
experts of skin. So if you need that help, do go for that help. And one thing I will say is that make sure that you are doing the preventative measures to help your skin to be healthy. Make sure you're drinking that water, getting your 2 liters a day. Make sure that you're avoiding a lot of sun exposure. Make sure that you know
mm,
you're using the right products as well and staying away from the products that will strip away those natural oils because
yeah,
at the end of the day we need to maintain that oil. So make sure that you know you don't decrease the natural oils in your skin. And if you need help, honestly, as we always mention, seek professional help.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
if you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.